The treatment landscape has recently changed. I was thinking about this earlier, that sickle cell disease has been understood and reported. So the first time sickle cell disease reported in the Western literature, medical literature, was in 1910. So we've had 125 years of knowing what sickle cell disease is, and sickle cell anemia was the first molecular disease, if you like. People had been able to work out exactly the molecular mechanism that underpinned the disease, and that was the first to ever been described. Despite having been there for so many years, drug development has really fallen behind compared to lots of other diseases that people have learned about much later. And that again brings us back to the theme of health inequalities. But what has happened is that despite the fact that we've for decades, for even a century, we've only had one drug. And then in the last few years, we've had a few more new drugs being approved. In America, there have been four more drugs approved so 4 drugs approved in America. In the UK, we've only had really conditional approval of Crizanlizumab, and hopefully newer drugs will come through as time goes. 4 drugs in 125 years is not something that one can be proud of, but obviously we cannot complain. Right now we're in a place where there are new options that we can treat our patients with. Crizanlizumab has been now approved for people over the age of 16 in sickle cell disease by NICE, who have, there are some conditional bits that's tied up with the approval, but we are increasingly now being able to recruit patients to receive that treatment in the NHS, which is very good news. The other good thing that has happened is that it has really excited the scientific world to kind of get more drugs in development. More pathways are being, certainly something that has come up is the pyruvate kinase. The PKLR gene enhancers, so there are new drugs that are improving the amount of the PKLR activity, essentially increasing the ability of the red cells to hold on to the oxygen a little bit better, causing less hypoxia, and also causing more ATP within the red cells, more energy in the red cells, so that the red cell does not break down that readily. So these are new drugs that have come. There are lots of new drugs that are currently under investigation. So we are now hearing more about newer developments. We are being approached to recruit patients to trials, which is not something that we've seen before. So I think this is the beginning of a good thing. We want more treatments to come through. I suspect in the end we will end up with a kind of multi-drug treatment of sickle cell, where some aspects of the pathophysiology will be addressed by, say, hydroxyurea, which will be the bedrock of treatment, and then we will be able to mix and match treatments and customize it to individual patients as time goes on. So exciting time for sickle cell new drugs.